Okay, everybody, welcome again. Thank you for your kind attention, for lending me your ears, and our guest speakers, your ears. We're very, very pleased to have Kathy Lavelle here from Summit ElderCare. And Summit is very close to us, and it's a nice alternative to nursing home living. So with that in mind, I'd like to welcome Kathy Lavelle from Summit ElderCare. Thank you for coming today, Kathy.
My name is Kathy Lavelle, and I'm the account site, which is 1369 Grafton Street, right down the road. And my first question to you today is, where would you like to age? A nursing home? Can I see a show of hands? Long-term care? Anyone long-term care? I hear the fish is good there.
Very good.
How about aging in place in your own environment where you're living right now? Who would like to do that? Well, I'm here to educate you, to let you know that that's our mission also at Summit ElderCare. We want you to be able to age in place in your own environment, primarily for two reasons. You live a longer life and you live a healthier life. And we have a program that is a program of all-inclusive care for the elderly. And you need to be 55 or older, live in our service area, which Uxbridge is our service area. You need to have 2 activities of daily living that you need assistance with. And that can be something as simple as being reminded to take your medicine, or possibly eating a meal. Or it can be more challenging as far as getting from one room to another, or needing help in taking a shower. But I'm here to help you through the process if it seems like everybody wants to age in place. So if you find that you have a need, that I can talk to you afterwards, or I can give you a tour of Grafton Street, the site that I work out of. I'm more than happy. I gave everybody my business card, and feel free to give me a call, okay? So the program can also, the all-inclusive piece is not only that we're able to assist you in your home with activities of daily living, we also have an adult day health program that you're able to come and join us and do lots of fun activities, and come see our wonderful gerontologists, and get physical therapy and occupational therapy and nutrition guidelines and things like that. How does that sound to everybody?
Good.
Good. Well, come see me afterwards, okay? And if you have any further questions, please feel free to give me a call, or I'll be over at the table after Paula presents. Thank you for your time.
Thank you, Kathy.
I can only echo that. Please learn more about Summit. It is a great program for many people, and if it works for you, I think you'd really benefit from it. So at this time, I'd like to introduce Paula Chauvin. She's a nurse at Summit,
That's right.
and she's going to talk to us today about arthritis, which is a topic that in the 15 years that I've been here, we've never had a guest speaker or a nurse come and talk to us about arthritis, and I think it's something that we can all benefit from learning more about. So I thank you so much for being here today, Paula.
Thank you, Marcia.
You're welcome.
So the presentation that I'm going to give today has been put on by the Arthritis Association. It was developed by them and the National Council on Aging. Usually this is an hour presentation, but I know that you're limited because you're on a schedule today. So I am going to go through these slides pretty quickly, and I think that you will be able to get the gist of it. If you have questions after, please feel free to stay, or you can always give me a call, or Kathy also. There's a couple of things that you can take away with you. One is this booklet that Kathy's been given out. You all have one, and it has really good information in it about arthritis. The other thing is that this folder here, which is on the table, she did not give you one of these, but it is on the table. Usually this program is pretty interactive, but I'm not going to make you talk because you're eating. So I'm just going to run through the slides, and hopefully, even if you can pick up a nugget from all of this, it will be worth your while for coming. So, putting pain in its place. Why are we here? We want to arm you with knowledge about osteoarthritis pain. I'd like to prepare you with some strategies for preventing it or for relieving pain. And I want to inspire you, that's the biggie, to do something every day to help prevent or make the pain from getting worse. I come with experience myself. That's kind of like a funny thing, but I have arthritis myself. I also have osteopenia myself. So every day is a little bit of a struggle to get up and to get going for the day and loosen up so that the day is better. There's many days I'd like to just lie in bed or sit on the couch and watch television and not move because the pain is there. But that's the worst thing you can do. So today's topics are understanding the pain, preventing the pain, managing it without medicine, using the medications wisely if they are needed, working with your doctor, and focusing on life and wellness, not on the osteoarthritis. Because it's what's in your brain and your thought about osteoarthritis that's going to get you through the day when you have a lot of pain. So let's first talk about the bone. It is a chronic disease. Osteo means bone, arthritis is inflammation of the tissue and the bone. And it is not part of aging. It's not the normal part of aging. So some people, if you ask them, do you have pain from arthritis? They say, no, I don't have any back pain. I don't have any knee pain. I don't have any shoulder pain. God bless them. How many of you here do have some pain in one of your joints? Okay, so a lot of you. And it usually starts to come around 50 or older, but it can come sooner. And basically, if you have sore joints and assume that you have arthritis, you may be mistaken. So you should always get a diagnosis from your doctor if you think that you are having pain from arthritis. Some people have been fooled. They think that they have arthritis, and in reality, it's something else. So in arthritis, you can see, osteoarthritis we're talking about now, you have your bone on the top, this is a knee, and a bone on the bottom. And that black area in the middle is some of the cartilage that's surrounding it. When people have osteoarthritis, whether it's in the knee, the shoulder, the spine, the neck, the fingers, some of that cartilage goes away. So see in the picture to your right, see how it's starting to get crooked? That's because the bone is no longer happy, let's put it that way. It becomes jagged, it's degenerating, and as it continues to degenerate, way on the left there, you'll see some of the bone is rubbing on the top and on the bottom. That's what gives you the pain. And people have some pain, some people have mild, some people have a lot, some people don't have much at all. It really depends on you. Some people have a very high threshold. Others just a little needle stick and they're going through the roof. So everyone is different, and the main thing is to be able to manage your pain at the time that you have it and the severity that you have it. When you do have osteoarthritis, the jaggedness in that bone releases a chemical in your nerve, and it goes to the brain as a signal to say that you have pain. So again, some people have a lot of difficulty handling it, and others do not. The pitfalls of pain. You have loss of muscle strength, and this is very evident when people are in a nursing home. Did you ever hear of people that get into a nursing home and then they're sitting in a wheelchair all day?
Yeah.
They don't do anything, they don't get up from that wheelchair, they might go to activities, but it's basically in the wheelchair.
Right.
A lot of that is because the nursing home is afraid that they're going to fall, and they don't have enough staff to be doing one-on-one help. So what happens is that when you don't walk or get on your feet, your muscles degenerate, they soften up, and you don't have strength. So with osteoarthritis, that can happen if you don't move. Are you getting a little theme here? What's the word that I keep saying? Move. Right, move. And don't let arthritis and the pain control your life. You're in charge, okay? So you can overcome and manage what you are getting every single day. Decreased mobility. Oops. Let's go back. Poor sleep. If you're in pain, it destroys your sleep sometime. And isolation and depression. Has anyone ever been invited somewhere and they didn't go because they had pain that day? That wreaks havoc with your family life, with your enjoyment of coming out to activities. So we're trying to prevent that. Why some people don't put pain in its place? Because they have some fears or they understand about some myths that are going on around there. One of them is that it's part of getting older. Hello. That's okay. So, we already talked about that. Is it part of normal aging? Is osteoarthritis part of normal aging? No, it isn't. It is a disease. There's also a belief that you can't do anything for pain. You can. You worry about pain medicine if you take it and the side effects. All medicines have some side effects. And, you know, we just have to live with it. Do you want to have a good quality of life and say take some Motrin or some Aleve if you can? Or do you want to suffer and not go out that day because you're afraid of a side effect of a medicine? You always need to check with your doctor because there are some acetaminophen or NSAIDs that cannot be related with your particular medications that you are taking, but a lot of them can. Or you might fear that activity is going to cause more pain. So what can you do to stop pain? You want to stop it before it starts. You want to use pain relief strategies and manage it safely with or without medicine, and you want to work with your doctor because he's got some strategies too. But unless you start telling him that you're having pain, either mild, moderate, or severe, he's not going to know. You know, when you go for your physical, write it down so that you're going to remember to talk to him about it. And focus on wellness, not on your pain. So the best way to prevent and to beat the pain, as I said before, is to stop it before it starts. Pace yourself. What does that mean? Can anybody tell me what pacing yourself means?
Don't do too much.
Don't do too much, right. If you've been house cleaning and all of a sudden your back is hurting, more so when you first started, stop, take a break. You can always go back to it. And is the dirt always there? Yes, the dirt is always there waiting for you. Protect your joints from stress. If you are going to lift groceries, instead of lifting something that's really too heavy, go and lift one bundle at a time. And the way you do it also by protecting your joints, don't just pick it up with your fingers, okay? Pick it up and then maybe hold it with your arm a little bit so that you're using your bigger arms and your joints, your larger joints, rather than your fingertips. Control your weight. Oh my gosh, this is a big one. Nobody likes to hear this, not with the donuts, the bagels, and all the good stuff that we eat. But by controlling your weight, you do have less pain, especially in your knees. Yes?
I was watching the Dr. MD, and they were saying that carrots help.
Carrots?
Yes.
Give it a try. Anything that you hear, give it a try. See if it works for you. Increase your physical activity. Again, the word move, it's not spelled there, but the word move should be there. Increase your physical activity and get a good night's sleep. Switch between the heavier and lighter tasks if you're going to pace yourself. Recognize the signals that you need to rest, like the pain's increasing, and don't overdo it. Protect your joints. There are splints and braces that you can use for your hands. You would need to talk to your doctor, and he would have you probably go to an orthotist, or through the VNA, somebody might be able to come in, an occupational therapist, and evaluate you. And practice good posture. Everybody here is pretty good. I think most of you are sitting up straight. Nobody is slouching. And that's good because your muscles stay strong when you have good posture and try to stay up straight. This is really interesting. I couldn't believe it when I saw this. When we talk about weight, if you take 4 pounds of pressure off your knees, you can do it by losing only 1 pound of weight. Isn't that amazing? So think of having 4 pounds of butter on your knee, and you lose a pound of weight in your body. Those 4 pounds that are on your knee go away. The weight from it and the pain from it. So, you know, think about that when you put that next donut in your mouth. And the way you lose weight, of course, we all know that physical activity and a healthy diet, that gets you there the fastest. So there's one thing that you gotta try. Experts agree. This will decrease your pain, it will improve the function and build your strength, it'll improve your mood, it'll fight depression, it'll boost your energy and improve your sleep, it'll help you control your weight, it will lower the risk of heart disease and diabetes, and it works, and it's free. And so that is move your body. We can all do it. And even if you did it in increments of 5 minutes taking a walk, or 10 minutes, or if you drive, parking at the end of the driveway rather than right at the door and walking, not during the ice storms, but on a nice day like this. Just get those extra steps in. Any activity that you do is better than no activity. And you want to build your strength and increase your endurance and maintain your flexibility. And I know that some of you are sitting there thinking, but I'm old, I can't do that. You know, we're all old, we're all getting there. But everybody walked in here, that's exercise. Everybody sat down and got up, that's exercise. So it's just to keep doing that more during the day. Talk to your doctor about any kind of exercise that might not be good for you, that you think might hurt you. And try to do some strengthening. Strengthening like with picking up some cans of soup and just going like this during the day. That's strength. Aerobics is your walking or your swimming. And stretching, it could be if you go to yoga or Tai Chi, or just do some stretching. And I've got those exercises here to help you get stronger. Moving will also increase your balance. One good exercise that a physical therapist told me about is just standing up, if it's okay with you, holding onto the chair, and just standing on one leg. That's a great exercise. And then do it again. And try to hold it for about 30 seconds. Just count to 30. Eventually, you might be able to let go. I haven't been practicing, as you can tell. Okay, but that's a really good exercise. And for balance, you prevent falls that way.
Can you use a cane while you're lifting your leg?
Sure, as long as your cane isn't going to fall out from you. So be careful. So to get moving and keep it up, you want to make the activity a priority. Today you get up and you say, all right, I'm going out, I'm going to use my car, and today when I go to Price Choppers or Hannaford or wherever you shop, say I'm going to park more towards the middle of the parking lot versus in the handicap, unless of course you cannot walk that far. So it's in little increments that you want to do it. Warm up first, know the signs that you've done too much, and choose the activities you enjoy. So at this point, I know you're going to eat your dessert. For those of you that would just like to do something and just hold off for like not even 3 or 4 minutes, I'd like you to join me with a little bit of an exercise, okay? The first one, and it's right in your booklet. The first one is with your neck. Okay. There is a precaution on this one. If you do feel dizzy, or if you do get numb or tingly in your neck, then just don't do it. Okay? So if you can just sit up straight, And you would just move your head to the right. Count to 3. And then move it back. Go to the left. Count to 3. And move it back. So what you've done is not only have you used the muscles here in your neck, you've also used the muscles in your scapula. And those are going to get stronger so that when you reach for something, you might not tear something in your neck or back. When you are driving, it's going to give you some more flexibility to see where you're going. So that's the purpose of those. The second one is very easy also. Shrug your shoulders. Just go up, and then go down. And go up, and go down. There's no precautionary measures for that. Anybody can do that. And you shouldn't feel anything from doing that. That is also going to provide relaxation for you in your shoulders, because you know sometimes we all get tensed up. That will do that, and it will also make you more flexible. So again, when you try to reach for something, you're going to have the flexibility. The third one is the shoulder blades. And I'm going to put this down for a moment. You would just put your arms up like this, making a W, and then you just go back a little bit. Can you feel the stretch in your back? Yep. Not way back, just to the point of comfort. And then come forward. And then go back. Now if you've had arm pain or arms surgery, you have to be careful. And then come forward. And let's do it one more time. Back. And then forward. It feels like you're not doing much because it's just a little bit. But if you do these every day, and you do just 3 or 4 repetitions of what I'm showing you, you are going to build strength and muscle. The last one also is easy. It's basically putting your arms like this and going back and forward and back and forward. Great. It's easy, right? Yep. It doesn't take long. And there's alternates to that too, also like just going like this with your arms. And you can feel that. So regarding your trunk, I'm not going to take up more time because we're running out of time, but there's about 3 other exercises on here. And when you read them, they're real simple and they're very self-explanatory too. So make sure you pick one of these up before you leave. They're on that table. So if your pain gets, yes?
We were talking over here. And if you live alone, if you do it in front of the mirror, it's a better thing.
You feel like you're in a gym.
Well, if you don't go to a gym. Yeah.
Yes. So if, don't hold your breath when you're doing the exercises. And again, if you get any pain at all, stop. And I don't mean pain because, ooh, that feels different. I'm talking about, ooh, I shouldn't have done that because it caught you. Everybody, when they do exercises, will have muscle tenseness the next day. Because if you're not doing exercises, your muscle is saying, what the heck are you doing to me? You know? And all of a sudden, you're changing your way of living a little bit because you're getting stronger. When you do exercise, most people say that it does help them sleep. And if you do get sleep, you will feel better. People who are tense, they don't sleep, they're tossing and turning all the time. If anybody feels that, you know, you don't feel good the next morning. You're just not right. And when you have either stress or lack of sleep, that's when the pain will get worse. Take a warm bath, listen to soothing music, avoid stress. Don't do your bills before you go to bed. You know, you want your brain to be nice and relaxed. If you want some pain relief right now, a combination of the pain strategies work best. Find out what's good for you and start those. Hot and cold treatments. Has anyone ever done those? Have they worked? A little bit, hot or cold? A heating pad or some
Ice
moist? Yes. If you want to relax, then you need to put something warm on. If you have inflammation or terrible pain that day, you can put ice or some type of ice pack. If you do the ice or the heat, make sure there's something between what you're putting on and your skin so that you don't burn your skin. And don't keep anything on your body for more than 20 minutes and then take it off because your blood needs to circulate. You can do either treatment 2 to 3 times a day, and that will give you some relief on really bad days. As far as medication, there's medications out there for you. There is the pain reliever, the topicals, the supplements. You have to see what's good for you, and again, consult with your doctor. Because people that are on Coumadin, some of these are not going to be good for you. There's also prescription medicine, like your opioids, and the doctors will prescribe those if your pain is really bad, and you need those to get through the day. And a lot of people think, oh, I never want to start that because I don't want to get, quote, hooked on them. If you take things in moderation and the way they're prescribed, okay, then hopefully this will be okay for you. It's better than just laying in bed and having your life just pass you by. But the doctor will know the dosage that's good for your age, your condition, and your weight. Because all medication is given to you by your body weight. Okay, there's also relief with physical therapy, joint injections. You have some pamphlets over there about joint injections that you can pick up. Has anybody here had the joint injections? Did they work for you?
You had the injection.
No, that's not for that.
No. Did they work for you?
Well, but it came back because it's chips off my hip.
Okay. How about yourself?
A little bit.
A little bit. You can have up to 3 at a time. Yes.
They worked for me, but then when I came back for the second time around,
Yes.
Medicare declined.
Oh, boy. Good old Medicare, huh? Okay. Just what you needed and wasn't covered.
Excuse me.
Okay. Yes.
Laser treatment?
Laser treatment, that's new. Have you had that?
Yes.
Did it work?
Yes.
Okay.
It's great.
Great. So see, you get tips. Ask your doctor. Laser treatment. Find out what it's all about. It's all the knowledge. Knowledge is power, as they say. So ask about an option there.
You wouldn't know you had arthritis when you take laser treatment.
Talk to your doctor. Yeah, it doesn't last. So talk to your doctor, see what he has to say about anything. And I guess to conclude, all I want to say is move. That's the main thing. And don't be afraid to take control. Okay? Your pain is there, but you actually need to control it so you can have a good day. We don't have many days left, correct?
Right.
We don't have like 50 years left in our life. So make the best of what you have. Good luck, and thank you for paying such good attention. Take care.